During the pandemic, hospitals across the country, including right here in Arizona, have brought in traveling nurses from out of state to help with staffing in crowded ICUs. Tonight, we're talking to a traveling nurse to find out what life on the road is like during these COVID times. News 4 Tucson's Eric Fink is live at Tucson Medical Center with the story. Good evening, Eric.
Sean, good evening. The nurse we spoke with spent 3 months at an Arizona ICU at the start of the pandemic. Now, these traveling nurses, they make more than nurses at hospitals on staff. One executive here at TMC says that can be challenging, but the nurse we're about to introduce you to says most of the time his colleagues are so grateful when he shows up at their hospitals to help.
More than anything at the time, it was just restlessness. You know, I was in my late 20s and I was just anxious to be exploring the country.
Well before COVID, Christopher Strain made the decision to become a traveling nurse 4 years ago. And since the pandemic, he's logged many miles and many long hours in hospitals across the country, going wherever the need is greatest. From May to August 2020, he worked in an ICU up in the Valley, where he saw our state's first COVID wave up close. Strain says his fellow nurses are thankful for the added manpower at a time when our healthcare system is stressed.
Especially with COVID, they're just grateful to have people on the floor, because when I was there in Arizona, one of the charge nurses, I think he had said he worked 16 days straight and he'd had 1 day off before he was going back for another 8 in a row.
TMC has 180 traveling healthcare professionals working in the hospital right now, most of them nurses.
Their rates of pay are significantly higher than what a typical core nurse makes, and that inequity is challenging for nurses to work alongside someone whose compensation package for the same amount of work is different.
Christopher says as he's traveled for work during the pandemic, lately he's been in hospitals that are short-staffed. Cooler says the burnout factor, coupled with the current surge in the virus, is very concerning.
That can show up in empathy and compassion fatigue. It can show up in greater number of sick days and leaving the healthcare workforce entirely, finding a different profession. And that only compounds the workforce challenges that we have today.
And back out here live tonight, Christopher says when he worked up north in the ICU at that hospital for 3 months, he was making $3,000 a week, including his housing and food stipend. We're live tonight here on the east side. I'm Eric Fink, News 4 Tucson.